So a mommy makeover is a generic term that covers surgeries that people have typically after pregnancy. So with pregnancy, people will typically notice that there's engorgement or enlargement of the breast tissue, followed by, nursing potentially, after which there's some deflation or ptosis of the breast afterwards. With distension of the abdominal wall, there might just be lax tissue, like the skin and the fatty tissue, but there also might be some laxity to the abdominal wall at the fascial level. Even more extreme than that, there might be laxity in the midline of the abdomen, what we call diastasis, where the six-pack muscles have actually separated apart. So mommy makeover typically addresses those two areas, but can obviously be combined with other procedures. Some people might want to include areas like the thighs, the legs, or even the arms. And obviously those can be combined with the mommy makeover, but a typical mommy makeover addresses the breast and the abdomen. So what's required in the breast portion of a mommy makeover really is determined on a case-by-case basis. Going from a range from most simple to most complex, some people will just need an augmentation. They say that they like that fullness that they had when they were pregnant, the engorgement of the breast, they really like that upper pole fullness. But then following pregnancy, they lose that, so they don't have that same fullness that they had. So an augmentation is a great way to get that upper pole fullness and obviously more volume. That requires placing an implant. Depending on where the implant is placed, you're going to get more upper pole fullness on some places than others, but that's one potential solution to the concern about the breast tissue. A second and more common option for addressing the breast tissue following pregnancy is going to be a breast lift. So in that instance, patients have had distension of the breast tissue, but then with deflation, their nipple areolar position has also descended with that. So to address that, a lift really does what the name implies. It lifts the breast tissue back up to where it used to be. Now, compared to doing that with an implant, obviously you're not going to get quite as much upper pole fullness, but it lifts the tissue back up to its ideal position. Another option is actually combining those two, where there's an implant placed, but also a lift performed at the same time. So that's an augmentation mastopexy or an augmentation with a lift. Now with that, you're going to be accomplishing different things. You're going to get the upper pole fullness and the volume from the implant, but doing the lift portion is actually going to give you that nice shape to the lower portion of the breast and reposition the areola at the most ideal position, which is really where the breast projects out the furthest. So combining those, the implant with the lift, really gives some people a perfect look. With regards to the abdomen, again, there's going to be distension of the abdominal tissue, but also the fascial layer. So really, this is also determined on a case-by-case basis in terms of what's going to be best to address your concerns. If it's just loose skin and potentially just a little bit of excess fatty tissue, doing liposuction and some body contouring with bodytite, which is going to help tighten the skin, might be a really good option. What that's going to do is obviously remove the fatty tissue with the liposuction, but then the bodytite helps tighten the skin around the underlying fatty tissue and waist. So if it's, again, just a little bit of excess, that might be a reasonable option. Some people will actually have laxity of the abdominal wall, which with pregnancy is fairly common, particularly if there's been multiple pregnancies or if you've had abdominal surgeries or massive weight gain and then weight loss. There's actual stretching out of the abdominal muscles. So just doing liposuction or bodytite isn't going to address that laxity at the fascial level. So to address that, doing a tummy tuck would probably be a better option. What that allows us to do is lift up the skin of the abdominal wall and look at the abdominal muscles. And whether it's just laxity there or actual separation of the six-pack muscles, we can do a muscle wall repair to help tighten it again. I like to tell patients that when you're considering doing liposuction with the muscle wall repair that's involved in a tummy tuck, getting that flat abdomen from the side view is really accomplished by tightening the abdominal muscles. There is some liposuction to the central portion of that tummy tuck, but because of wound healing issues, we don't want to be super aggressive with the liposuction prior to a tummy tuck. Obviously, the liposuction, we want to be very aggressive, going laterally and around to the backside. So that's our opportunity to be real aggressive with the liposuction. The contouring of the flanks, on the other hand, is really going to be accomplished by, one, cutting the tissue out, but then secondly, the liposuction, because we can liposuction areas that aren't going to be cut out. So to really get that hourglass figure that you had prior to the pregnancy, combining liposuction with the tummy tuck might be the best option. So once we determine that a tummy tuck is the right option for you, the next step is determining what type of tummy tuck. Starting with a standard or a full tummy tuck, what that's going to accomplish is really addressing tissue on the front side of the abdomen. So when you look at someone, if it's just excess tissue from about the level of the hip bone to hip bone, a full tummy tuck would be reasonable. So again, with that, we're going to be lifting up the skin, looking at the six-pack muscles, tightening the six-pack muscles so that when you look from that side view, your tummy is nice and flat. But excising the tissue that is lateral or to the side of your six-pack muscles is really where we get the bang for the buck with a standard tummy tuck. Now, some people will present and say that they really don't like the flank tissue. And if that's the issue, or on top of tightening the muscles from this view so that you have a flat tummy from the side, by excising the tissue with an extended tummy tuck, that's really what's going to be recommended to give you the best optimal aesthetic result. The most extreme version of a tummy tuck is what's called a circumferential tummy tuck. A circumferential tummy tuck addresses tissue that goes all the way around the trunk area. So not only on the front and the flanks, but if there's excess tissue on the back, that's going to help address that by basically lifting up a portion of the buttock and also pulling the back tissue nice and tight. That also helps address these areas near the bra strap deformity, help smooth that out. So combining that with some liposuction might also be a great option for you. Again, it really depends on what you're wanting to accomplish with the trunk portion. The recovery from a mommy makeover really depends on what is done during the breast portion and the tummy tuck portion, but in general, what I usually tell people is that they're not going to have any activity restrictions by about 6 weeks after surgery. Now, for you to feel as good as you do today prior to surgery, I usually tell patients you're just going to take about 3 to 4 months. That being said, you are going to be up and walking the same day as surgery. So I don't ever want someone to have this type of procedure done and then just lie in bed, because that's a massive risk factor for a lot of things. It leads people to becoming malnourished. It's a higher risk for complications like blood clots. There's wound healing issues if you're lying on the incisions. So I want you to be up and active. But again, I don't want you to be so active that you're putting tension on some of the places that were just operated. So if you think about a tummy tuck, what we're doing is excising the tissue along the abdomen. So in order to do that, we're taking a decent amount of tissue away, and you're going to be in a somewhat hunched position initially after surgery. By about 3 weeks after surgery, you'll be back to standing up straight, but there's still going to be some swelling. Most of the bruising will have subsided, but we're going to have you in special garments to help with the swelling. Some people will also still have some drains at this point, which is completely normal. That's to help get the fluid out so that the swelling subsides more quickly. Once the drains are out, you can also do things like lymphatic massage, and just being up and moving is going to help mobilize that fluid to help with the recovery process. And again, by about 6 weeks after surgery, you can do anything that you feel up to doing. There's no restrictions in terms of lifting, activity-wise, in terms of exercising like running. That's completely fine at that point. For you to feel as good as you do today after mommy makeover is going to be about 3 or 4 months. With respect to the breast portion, I have similar restrictions for after surgery. I don't want you doing a lot of heavy lifting, but I do want you up and moving. So in terms of lifting, I'd like for my patients to restrict it to about 10 pounds for about 6 weeks after surgery. Again, after 3 weeks, if you feel up to walking around the block or even walking on a treadmill to get your heart rate up a little bit, that's completely fine. But when we place the implants underneath the muscle, or if we're using implants in that case, then I don't want those implants to be displaced. Similarly, if there's just a breast lift performed, there's going to be swelling. And by moving your arms too much, lifting things that are too heavy, you're going to exacerbate that swelling. So there's a happy medium of staying active so that you're minimizing complications, but also getting the best aesthetic result by helping swelling and fluid mobilize so that you get to that optimum aesthetic result sooner. The best candidates for mommy makeovers are those patients who want to address both the breast as well as the trunk area. That doesn't necessarily have to mean that you've had previous pregnancies, but if those are areas that you are concerned about, that's going to be a good opportunity to address it as a combined procedure. Now, I would say the most ideal candidate is someone who is done having pregnancies. And the reason for that is really that abdominal wall laxity that we're addressing during a tummy tuck. Because if we do that too early and then you decide to have future pregnancies, what's going to happen is it's going to put a lot of pressure on your abdominal wall. Some of those stitches that are in place or the scar tissue that is formed can be put on tension. So it really minimizes the amount of space that you have inside that fascial wall. So again, the most ideal candidate is someone who has had previous pregnancies, not planning on future pregnancies, has issues or concerns with regards to the breast and trunk area, whether it's deflation, whether it's ptosis or drooping of the breast, drooping of the skin, excess skin, stretch marks. Those patients are all great candidates for a mommy makeover. One of the main concerns that patients will tell me about when they're about to undergo a mommy makeover is that they're worried about the pain. So operating on a large surface area, operating in a lot of different areas on the body, so they're worried that they're not going to be comfortable after surgery. What I tell my patients is I want you to be comfortable prior to, during, and after surgery. Even though you haven't had surgery, When you're asleep, before we even make an incision, we use local anesthetic to numb up the skin in the areas that we're going to be operating. So even though you're asleep, I want you to be comfortable. And obviously during the surgery, you're going to have an IV in place so that my anesthesiologist can give you extra medicine if needed through the IV to keep you comfortable. After surgery, we're also going to give you what's called a multimodal pain regimen. So we're not just going to throw a bunch of pain medicine at you and expect you to recover uneventfully. It's going to be a different combination of medications so that the pain receptors are addressed adequately. There's going to be nerve pain medication, narcotic pain medication, anti-inflammatories, and depending on whether or not you've had massive weight loss surgery, if your stomach is able to tolerate it, medications like Celebrex to also help with pain that can help with. That being said, we don't expect you to be completely pain-free after the surgery. There are also things that we do during surgery to help with your discomfort. Particularly with breast surgery and the abdominal portion of the surgery, we do what are called blocks. So the nerves that supply a lot of the sensation to the areas that we are operating with will inject local anesthetic around those areas to help give you some numbing effect in that area for a few days after surgery. That's just part of any breast surgery or tummy surgery that we do here, not necessarily extra. Now, with regards to that, there are options that have longer lasting effects like Exparil. Exparil is a local anesthetic that just lasts longer compared to lidocaine or Marcaine because of how it's formed. It takes the body longer to break it down, so you get the longer effects. I never tell my patients that they have to get it, but if they're concerned about pain after surgery, that's one great way to address it. Another major concern that patients will tell me about prior to surgery is scarring. Obviously with a mommy makeover, depending on what's done, there can be a lot of incisions and a lot of scarring that happens after surgery. As an aesthetic surgeon, I want that to look as good as humanly possible. So part of that is going to be making sure that your incisions are closed with very little tension, but there's also things that we can do after surgery as well. I want to give both the breast and the abdomen the most aesthetic contour possible, which means putting an appropriate amount of tension on there. But I also don't want to make things so tight that you're putting tension on it when you're trying to stand up or move around, because that's going to cause the scars to widen. Now, obviously, you're going to have incisions that are closed with sutures that go away on their own. I also like to put a little bit of glue or stereo strips on top of the incisions to prevent bacteria from getting in. Those are typically in place for about 2 or 3 weeks after surgery. Once we remove that glue or the stereo strips, you'll be able to see where the scars are, but that's not the final result of what the scar is going to look like. For a scar to be mature or be at its final point, it's going to take about a year after surgery. So that gives us a lot of time to intervene. For the most simple way to address the appearance of the scar, I have my patients do what's called scar massage. So once you're able to see the scar, I want you to apply pressure and do a massage in that area to help you keep the scars nice and thin. Some patients also like to go the extra length of doing what's called silicone sheets. So I like to combine the silicone sheets with the scar massage because I think that gives you a very nice result. Basically what that does is it tells the cells that form really thick scar to kind of keep it calm after surgery. If you start to notice that you have hypertrophic or keloid scarring, then we can talk about doing other things like injections of either steroids or 5-FU. And what that does is, again, is another layer of telling those cells that form really thick scar to kind of keep it cool for the few months to years after surgery. So depending on if you have a history of prominent scarring or you have a family history of prominent scarring, that's something that we can talk about at your consultation. With any tummy tuck, I will perform what's called muscle wall repair or plication of the abdominal muscles. What that addresses is, again, the laxity that we have from our breastplate down to the pubic bone. So some patients, again, are great candidates for liposuction and they don't need that muscle wall repair. The patients who have laxity in this central portion here would greatly benefit from that muscle wall plication. And a good way to determine if that's necessary is to assume what's called the diver pose. So if you are looking in a mirror and kind of lean over, and if you have any laxity here when you're looking in the mirror, that could be addressed by the muscle wall plication. That's not something that's going to be addressed with just liposuction. Again, liposuction is great for getting rid of the fatty tissue, but it doesn't actually tighten the abdominal wall. So again, tightening of the abdominal wall is what I think, more so than the liposuction, gives you that really flat appearance to the abdomen from that side profile view. If you have any questions about mommy makeovers or would like to see us in clinic for a consultation, please don't hesitate to reach out. Also, don't forget to like, comment, and subscribe below.